He's one of the most well-known public health doctors in the province who often led the way in the battle to flatten the curve. Tonight, I have a chat with Dr. Lawrence Lowe, the medical officer of health here in Peel Region. We talk about the crippling third wave, the moment that brought him to tears, and what it took to get Ontario's COVID hotspot under control.
I've always been asked about sort of my leadership approach, and I say, make sure that the room is filled with people that are smarter than you are.
2021 has been a year of the wave. It's when the pandemic shifted, new variants emerged, our healthcare system became overwhelmed, and for much of the year, Peel Region was the hotspot in Ontario.
What was the moment when you realized, that things were going to get really bad before they got better?
It was at the moment where I realized that the variant was actually going to outrace our vaccine efforts. And so I was on a Teams meeting with my team, and I just suddenly was overcome with emotion. That was a difficult moment where I realized, I said, if we don't change course now, things are going to get really rough.
We're going to start here with our breaking news. Peel Region bringing down the hammer on COVID-19 infections in the workplace, ordering businesses with 5 or more cases to close.
You did emerge as a leader throughout much of this pandemic. I mean, you took on Amazon, you shut down workplaces, you canceled wedding receptions. And if you think back to April, you were the first one to come out and say we need to close schools.
As a parent, I know that it was sudden and very stressful, and I regret any inconvenience.
What was it like having to come out and make those very controversial calls?
I trusted the science, I trusted my team, certainly had the support of our council, our community. The reality is we were having so many exposures, so many whole school dismissals that COVID was already closing our schools for us. And so that was, one of the examples of one of the really difficult decisions that my team struggled with.
I know that you and many other medical experts out there spent many, many, many months calling for paid sick leave. The province eventually caved. But do you think things could have been different, especially in a city like Brampton, if workers got more paid sick leave much earlier?
I don't presume to understand or speak to what sort of decisions are being, the timing of these decisions, but ultimately I think I speak to what is needed and what's right for our community at the time when we do see it.
Dr. Lowe, along with Peel Region mayors, also put relentless pressure on the province to flood the hotspots with vaccine.
So what was that like, having to play hardball with the province time and time again?
I didn't see it as hardball because ultimately, as a physician and a scientist, I have to speak to the truth of the data and evidence.
And now the region that was once on fire has stabilized with a soaring vaccination rate of nearly 90%.
Would you say vaccines were your saving grace through all of this?
Almost 12 months ago, we had not delivered a single vaccine dose in the region of Peel. We were just days away from having it even arrive in the country. But here in the region of Peel, we've now delivered over 2.5 million vaccines.
One thing you may not know about Dr. Lowe, he took the job as Peel Region's top doctor just 2 days before the very first lockdown in 2020. He tells me it's been a whirlwind.
I always said, I want to work globally, but the one place that I would work at in Canada, if I could, would be the region of Peel. And I don't know if that was some kind of final destination sort of premonition, but then March 13th, 2020, it came around, and I haven't looked back since.
Dr. Lowe tells me he's an avid runner, and that's one thing he did almost every day in this pandemic to help clear his head. He also said that none of this would have been possible without the incredible team behind him. In Brampton, Shauna Hunt, City News.